Hello everyone, my name is Julia Diesel, and I will be talking today about post-traumatic stress disorder, also known as PTSD. This video project is for Amanda Maxwell's senior seminar course at the University of North Carolina, Asheville, and I'm going to talk about some potential solutions to treating PTSD symptomology. To get started, I'd like to give you a roadmap of where we will be going today. First off, I wanted to explain why I selected PTSD as my topic. PTSD is something that I have struggled to overcome and is something that has affected a number of those close to me, so it's become a topic that I'm really passionate about. In today's presentation, we'll begin by covering the prevalence of PTSD and the array of individuals who are affected. Then we will discuss causes and common symptoms of post-traumatic stress disorder. And finally, we'll explore some existing treatments before delving into my proposed solution to address symptoms of PTSD. The prevalence of PTSD worldwide is approximately 8%, and I think 8% can sound like a small proportion, but this equates to nearly 25 million Americans living with PTSD. To give you another idea, this equates to approximately 1 in 12 people. Next, I'd like to talk about the causes of PTSD. One study broke down the causes of PTSD globally and found that 33% of cases resulted from acts of sexual violence. Interpersonal network traumatic experiences accounted for 30% of cases, and this would include things such as an unexpected death within one's family or close community. Next was interpersonal violence, accounting for 12% of cases globally. Exposure to organized violence accounted for 3% of cases and includes things such as refugee status or living in a war zone. Participation in organized violence would be things such as military service or similar experiences and accounts for 11% of cases. Finally, this study created a category of other. This final 12% of cases included things such as vehicle accidents and natural disasters. There are a number of symptoms that accompany PTSD. I would like to highlight a few of the most common ones. Flashbacks refer to intrusive and vivid memories of the past. These often relate to the traumatic experience itself. Individuals with PTSD also experience a number of sleep disturbances. This could mean symptoms similar to insomnia, to waking up every few hours. Additionally, many individuals experience very disturbing and vivid dreams. Avoidance is a common behavior in anxiety-based psychological disorders, and this refers to avoiding stimuli that are triggering or anxiety-producing in any way. For example, I knew an individual that had been assaulted one evening when leaving a grocery store, so they tried to avoid groceries out of fear. You can imagine how challenging some of these symptoms are in the day-to-day lives of these individuals. Negative changes in mood and mindset commonly occur, bringing about anxiety and depression-like symptoms. Imbalance in arousability means that individuals with PTSD are unable to maintain the appropriate balance between their sympathetic nervous system, which is their flight, fight, or freeze system, and their parasympathetic system, their rest-digest system. In this way, many people with PTSD have a different resting state and can be stuck in hypo or hyperarousal. Hypoarousal could present itself as numbing or disconnect, while hyperarousability would look like hypervigilance and an easier startle response. Please note that there are many symptoms beyond those listed here. There are a few main treatments I'd like to highlight for PTSD. The first are cognitive behavioral therapies. These therapies aim to check cognitions and behaviors that may be negative or unhealthy in nature. This type of therapy aims to help individuals break down these thought processes, and examples would include eye movement desensitization and reprocessing, known as EMDR, or types of exposure therapies. In addition to cognitive behavioral therapies, medication is commonly used. The primary medication used for PTSD treatment are SSRIs, or selective serotonin reuptake inhibitors. SSRIs serve to mediate the uptake of serotonin, increasing available quantities at the synapse. This rise in serotonin levels has been found to help with a number of depressive and PTSD symptoms. There are many other forms of antidepressant medications that are frequently used as well. There are also a handful of non-traditional treatments that are well integrated into PTSD treatment. These would be things such as yoga and meditation, as well as therapies such as art, music, and animal therapies. My proposed solution is a synthesis of 3 different non-traditional practices. The first is mindfulness practices, the second is trauma-releasing exercises, and the third is a mindful breathing body scan. And I'm going to take a moment now to describe each of these in greater detail. Mindfulness can come in many forms, and to sum it up, the goal of mindfulness is to bring one's attention to the present moment without judgment. Elimination of judgment can be really key for individuals who experience PTSD because commonly their experience brings about feelings of shame or guilt. Mindfulness includes everything from mindful eating to meditation, journaling, setting an intention, or becoming aware of colors and sounds in the environment. This is the first piece of my proposed solution, and I would encourage individuals to try a variety of different mindfulness practices. The second piece of my proposed solution is that of trauma-releasing exercises, or TRE. These exercises are a series of poses held by individuals to bring about a neurogenic tremor in the muscles of the trunk and lower abdomen. Pictured here are a few of the example exercises that are used sequentially to induce the tremor. You may be wondering what a neurogenic tremor is. Really, to get to the core of what this is, you can imagine a pronghorn being chased by a cheetah, so a predator and prey situation. After an intense chase period, the animal will experience a period of immobilization or freeze response. If it has been caught by the cheetah, this freeze response is an attempt to cause the predator to lose interest. For example, a predator would generally maintain more interest in prey still struggling or trying to escape. If the prey has not been caught by the predator, then this freeze response is followed by a period of violent trembling. This trembling is caused by activation of the sympathetic nervous system that we talked about earlier, and is a method of energy release. In the wild, we do not see pronghorns, antelope, or any other prey animals developing trauma after a chase. Rather, they undergo this energy release and return to their day-to-day lives. This tremor is believed to be an instinctual response, and inducing tremors with PTSD populations has been found to increase bodily awareness. Increasing awareness can be key for individuals with PTSD because oftentimes they feel disconnected from their bodies and stuck in the past, and exercises like this can help bring individuals back to the present. The third and final component of my proposed solution is that of mindful breathing body scans. A body scan is a guided breathing exercise that may be performed seated or lying down. Individuals typically begin by bringing their attention to their breath, and then their attention to different parts of their bodies, moving from head to toe or vice versa. The beauty of these exercises is that they may be in depth, lasting more than half an hour, or they can be as short as 2 to 3 minutes. Similar to mindfulness and TRE, mindful breathing exercises such as body scans have been found to decrease rumination and help moderate the activity of the limbic system. These practices can also help with attentional skills, which can help individuals with PTSD redirect their attention to the present when faced with a challenging or disturbing thought from the past. Ideally, my proposed solution could be hosted in recreation or community centers. Examples would be yoga or dance studios. All that is required is a quiet space, and I would like to propose that a TRE and mindfulness practitioner be available in the space to instruct and guide as needed. Individuals could utilize the space to come and learn the exercises, and then could practice on their own as desired. An example schedule of this treatment would look like an individual performing TRE twice a week, body scans a total of 3 times each week, and incorporating about 5 minutes of mindfulness into each day. It is important to understand that each of these practices can be done either individually or in community. Individuals should play around to find the schedule that is best tuned to their current needs, because ultimately everyone's process is going to be individualized and look a bit different. There are no standout counter-arguments that would dismiss the potential for mindfulness practices and TRE in trauma treatment. The main contraindication would be determining whether or not these approaches are safe for individual participation based on symptomology. For example, someone with acute aggressive symptoms may not be the appropriate candidate for neurogenic tremors and assessing arising thoughts with non-judgment. While these practices are not a set solution to fix the challenges PTSD presents, they are intended to help individuals in building toolkits to use for their symptomology. Additionally, these exercises may be used in combination with more traditional methods, such as cognitive behavioral therapy or medication. Ultimately, while the prevention of PTSD can be challenging, there are many promising solutions for improving quality of life and managing the disorder. Please see the following slides for a list of references and some resources on where you can learn more about these practices. A special thank you goes to Dr. Amanda Maxwell for aiding in the creation of this video, and to the UNC Asheville Media and Design Labs for their help with editing and content. I'd also like to thank each of you for taking the time today to learn a bit more about post-traumatic stress disorder, common symptoms, and the wide array of existing treatments. I believe that through education, we can create a more informed community to help those experiencing PTSD. Thank you.